So what you see here is what we call a waterfall plot. And you can see here that 7 out of those 20 patients who went into the analysis had either a partial or complete response. And by that, we mean that we have 6 patients with partial response represented by the light blue color and 1 complete response represented by the dark blue color. And that makes a best overall response rate of 35%. You can also see what happened to the other patients. We had a couple of patients with stable disease and a couple of patients with progressive disease. So going to slide number 11, we are excited about the fact that we've seen response in non-injected lesions. That can also be called abscopal effect. And we saw it in several patients, and we saw it in both part 1 and part 2. So what am I talking about? Well, what this little picture is trying to illustrate is that we will inject the virus into one melanoma lesion. And then we are also interested in looking to see if the systemic effect from the virus is able to impact positively on lesions that were spread around the patient and not injected by the virus. And that's what we call abscopal effect, or effect in non-injected lesions. And so these are very early data, but very exciting for us to see. Something we haven't seen much at all with oncolytic viruses. And what we did here was, in collaboration with Professor Wolchok, we did set a limit for how to count or classify a non-injected lesion as an abscopal lesion. And we said that we were going to go for those uninjected lesions who had shrunk by at least 30%. And that's, if you are familiar with the RECIST criteria, the criteria for response. And we saw, when we looked at these non-injected lesion responses, actually 2 non-injected lesions that had completely disappeared. So exciting data, early data, and we will continue to analyze these data, but of course publish later on.